Numbers of infections of COVID-19 in the country has been on a steady rise. The latest figure announced shows there are 4,641 and 150 deaths. 902 persons have been discharged. But so far, adherence to containment measures directed by the Nigeria Center for Disease Control has been poor. The federal government is concerned about these counterproductive habits that could further spread the virus.
About compliance with the lockdown measures continues, and also a greater worry is the counterproductive habits that could further spread the virus. Now, the Presidential Task Force on COVID-19 is talking about wearing of face masks and how this simple preventive measure could become an active source of infection if it is not properly done.
With the exception of fabric masks, every disposable mask used is a hazardous medical waste and should be disposed of properly, preferably by burning. It is very risky to share masks as the virus is capable of remaining on surfaces for several hours and you could get infected through the processes of sharing masks. 3, the unhealthy practice of picking up disposed masks for whatever purpose is harmful to both the individual picking it and whoever procures it later.
Kano State is beginning to record success in its fight against the virus that almost brought the state to its knees. Health authorities have also revealed that there is currently no new infection among health workers.
We had responded to the situation in Kano by dispatching a team of medical experts that is providing technical support to the State Ministry of Health. I am pleased to inform that the team has done very well in their assignment and has reported a lot of success in helping to stabilize the state's health system, to assuage the disquiet among health workers who are going to restart routine service delivery, particularly immunization, antenatal clinic, and so on.
The national coordinator insists the ban on the interstate travel will be enforced and asks state governors to monitor compliance and enforcement.
The movements of people across state lines is actually against the lockdown process. We urge the public to please refrain from interstate travel. Only travel that is essential or travel involving the conveyance of essential goods is allowed. Movement across state borders is fast-tracking the dissemination and spread of the COVID-19 pandemic across the country. We are also advising state governments and security agencies to increase those measures and surveillance required to keep people within the state borders.
The concern now is the increase in community infection, and efforts are intensified to enforce compliance with the lockdown measures.